So I've had a lot of questions and DMs from folks who are about to get transfeminine bottom surgery or vaginoplasty and are worried about going to the bathroom afterwards. So in this video, we're going to talk all about going to the bathroom after your bottom surgery. Specifically, I'll focus on vaginoplasty. And so first of all, to kind of run through in my practice, usually what we do is patient stays typically about 2 nights after bottom surgery in hospital, and then they're going to go home or back to their hotel or wherever they're staying with a catheter that they pee through and packing in the new vagina. Now, constipation is very normal after any type of surgery, and this is because we're giving you lots of medications around the time of surgery, including the anesthetic itself, which slow down your GI tract. You're not eating as much as usual usually, and also if you need opiate medications, they're a big factor in causing constipation. So that's normal, and usually we just kind of go with it. Typically most patients won't have a bowel movement for about 3 or 4 days after surgery, but typically they'll be doing that at home with the catheter in and the packing in. One thing patients are really worried about, that straining, which is oftentimes necessary because you are going to be a little bit constipated after surgery, is going to cause a problem with the new vagina, and I reassure patients it won't. In my career I haven't seen it, and that's usually not a problem. So usually number two, I should say, not a big issue after surgery. It usually comes in the first few days and doesn't cause much harm. Now, when the packing is in the new vagina, for most folks they're not going to be able to pee with that in, and that's why we have the catheter in the newly designed urethra. And so the catheter is just a little tube that sits in there. You don't really feel it, you get used to it, and it's super easy to take care of, and you're going to go home with that for a few days. We'll show you how to empty it and to take care of it. And then in my practice, usually about 7 days after surgery, you'll come back to me. That's going to be a big day. We're going to get the catheter out, we're going to remove the packing, and we're going to teach you how to dilate. Now, once the catheter comes out, your bladder is going to be empty because it's been empty in your bladder all along. But typically most girls will go to do number one within the next hour or two. And a couple of things to be aware of after gender affirmation bottom surgery. One thing I'm always talking to you guys about is things swell. And when I say they swell, they really swell. Unfortunately, in some patients, it can be 2, 3, 4 times the size it's supposed to be. So, and oftentimes that swelling is going to be pretty asymmetric. So it's very normal when you go to pee for the first time that it's going to kind of shoot all over the place. And usually the stream is quite disorganized as that swelling remains. And so sometimes it can be off to the side. It can be a little bit more messy when you're going to the bathroom, and this is just something you have to get used to, but it does pass in most patients. Most patients, they can have a little bit of frequency in that they're going to the bathroom more than usual, or urgency, meaning that when they get the urge to go, they gotta go. So all of that is very normal while the swelling's there and when your pelvis is getting used to the new anatomy down below. So typically, even sometimes folks can have accidents, but that tends to be more rare. But this is usually how it goes with going to the bathroom after bottom surgery, and the vast majority of patients agree that it's really not as bad as they may have imagined. I hope this helps.